let's talk about the healthcare costs in the United States. It's no secret that the United States healthcare system is a disaster. And healthcare costs in a new study are keeping many Americans, 1 out of every 3 Americans, from even going to a doctor or a hospital if they have something that needs to be taken care of. They just can't afford it, don't want to worry about the deductible, don't want to worry about the ambulance costs or anything else. So they decide they just stay home instead because of these new healthcare cost numbers.
That's right. According to a new poll, Americans have reached their breaking point. That means 30% of them have postponed or just not gone in for treatment that they otherwise need because they cannot afford it. That doesn't necessarily mean they don't have insurance. It could mean that they have insurance and it's still too expensive for whatever the treatment is because healthcare system has no real rules about what they can charge because last year the Supreme Court ruled that now hospitals have to disclose what they're charging patients. We now can see with our own eyes that they change the price based on who is paying and whether it's an insurance company or a cash payer, and they can just do that. The Supreme Court only ruled that we can see it. They did not rule that they must stop it, right? Mm-hmm. And so because we have no real socialized medicine that provides service for all, most of us are going to have to now rank our care versus based on how important it is. And the problem with that is when you put off preventative treatment and you don't have your regular, say, annual scans or mammograms or colonoscopies or anything like that, you are not finding what could save your life. So this is obviously very troubling, but not if you're an insurance company. If you're a medical provider, you can continue to surge your prices and it's fine. It's all right for some.
Lisa Pettit in our chat says, my deductible is $5,000.
What?
$5,000.
And you have to hit that in order to get anything covered?
My Imperial Majesty in our chat says my deductible is $8,700.
Wow.
Holy smokes. Ula Hula says my doctor charges like 90% less if I pay out of pocket.
Yes. Cash buyers will always get the best rates because they know they can't surge it for an insurance company. So in fact, I refer you to the interview we did with say his name.
Andrew Schoonover of Crowd Health.
Yes. And he talks about how if you use his system and you are always a cash buyer, you will get the lowest amount.
This is a really startling number, though. David, you were going to say?
Well, I was just going to say there's when those urgent cares close to my house here. And when I don't have insurance. So when I go in, I get cash prices. So I see exactly what things are going to cost me. They're like, this is going to cost you $60. This is going to cost you $30. And they break it down for me. But then in insurance, that's probably like $800 or $2,000.
Yes.
Just looking through the chat here, David, you want to throw these up on the screen. Becky Medved says mine is $5,000. Lisa Birch Eisel says my deductible is $8,700.
So living in Europe right now and seeing what the actual price of healthcare is, I am shocked. And I usually, when they give me a bill, I just start laughing because I'm like, really? So my daughter had an ear screen.
Laughing in a good way.
Like, are you serious? This is how cheap it is? And they're like, this is the price.
Well, someone just said in our chat they had an ear infection, $1,500 for an ear infection.
So our youngest had inflamed ears for 2 checkups in a row, and the doctor was concerned about it. Turns out she had COVID, and so she was inflamed for a different reason, but we didn't know it at the time. So he wanted her to go through a full screening of her hearing, and they didn't charge my insurance for one of her visits. And so they gave me the full price bill, and they're like, sorry, we don't have your insurance on here. Here's the bill. For a full ear exam, it was €45. And I was like, wait a minute. Right. This is full price. It's right. $45.
This is a typo.
Yeah. And they're like, no, this is the price. So they ran my insurance and they're like, oh, here you go, $250 with my insurance. €2.50.
Oh, which, they meant $250.
No,
$2?
Which ends up being about $4, right? But even out of pocket, I would have paid about $50 for that's the price of getting a child an ear exam. And that is not an exorbitant price for thinking about I'm paying for an expert's time with their expert equipment. In America, I happen to know that would cost at least $250.
Yeah.
Well, and think about this, because these insurance companies have people that mitigate risk. So they know what things cost and how much they pay out and everything. So they know that if they set you at a $9,000 deductible, that chances are you'll never hit that with medical expenses. So you're paying them by the month for that $9,000 that they'll never dip into, which means they never have to pay anything. And they know that because these risk analyzers know what it's going to cost somebody.
Matthew Stusser in our chat says, I had minor hand surgery in the Czech Republic. It was €15.
$15.
$15.
Yeah.
$15. Yeah, they don't.
I mean, this is my regular experience with healthcare here, and we have very good healthcare. I've been thrilled with our doctors, and I spent dental procedures. $60 for a checkup. That's it.
And that's why so many Americans are going massively into debt. I mean, that's why medical bills right now, as this new study points out, medical bills are spiraling so far out of control that even 20% of the country's highest earners, those making over $120,000 a year, say the cost of seeing a doctor keeps them from seeking treatment. You know it's bad now that the wealthy, the top 20% of earners, they're at their breaking point, basically.
Yeah. A new book came out, came out this year called Social Security, Medicare and Government Pensions. And he talks about how people who are on American socialized medicine, right, Medicare and Medicaid, have consultants to help them pay for the exorbitant prescription drug prices that are allowed, right? We're allowed to gouge senior citizens. And a lot of these consultants that actually work for the government help people get their prescription medicine from Canada or Mexico. Like, this is part of like how our own system says, I know it's too expensive here. You need it. This is our program. Let me help you order it from a different country. Jeez. Something's wrong when that is the case.
Yeah.
But it's allowed. Why? Because of Congress. It's allowed because Congress wants it to be allowed.
It starts right at the federal government level, and they're absolutely in crony capitalism relationships with all of these drug companies, these healthcare providers. They're all friends, and it perpetuates this system. I mean, that's exactly where it comes from. It's not your fault; it's their fault, and that's the broken system that we have in the United States. Unfortunately,
it's this system that actually made me start looking at Medicare for all, because I'm like, why should somebody that by no fault of their own ends up getting cancer, and then they're riddled with debt for the rest of their life that they can't get out of? Like, you're talking cancer, you're talking hundreds and hundreds of thousands of dollars of bills and hospitalizations and stuff like that. Why should that person have that debt? Like, we should not have medical debt in this country.
Yeah.
No one should.
No. And it's absolutely life altering. Forget the injury or forget the surgery. Now you're saddled with this, hundreds of thousands of dollars in debt. You're never going to be able to pay it back.
Yeah.
Never going to be able to pay it back.
And there just really is no recourse for that kind of thing. It's really scary. And so what did our Congress do is punish us for not having health insurance, through the Affordable Care Act, meaning you have to have health insurance or else you pay a penalty.
Right.
That doesn't really help. It doesn't. I mean, it did bring down costs of certain programs, but not across the board. It's not accessible for everybody by any means.